Okay, all right. Hello, everybody. It's Dr. Alex Earl and Dr. Vidal. Woo! And we're here at Pure Plastic Surgery today, and it's Hump Day with Dr. Alex Earl. All right, everybody. So, yeah, exciting news. As you all know, Dr. Vidal has started here at Pure 100% full-time. We're all super excited. And because, kind of an honor of her starting here, we've dropped a tremendous amount of really great specials. And honestly, I think right now they're like the best deal in plastic surgery in the whole US right now. I mean, honestly. So you get to come to Pure, you get to come to a private practice. You're not into some surgery mill where they just kind of turn you in and out. So private practice, all the stuff that we have here at Pure, and of course the great talents of Dr. Vidal for very good pricing there. So all of you, take a look at that because there's not going to be a deal like this. It's not going to last very long, and spots are filling up very quickly. All right, but today we wanted to talk about something that's kind of very near and dear to us. It's one of the most important things here at Pure. It's really our top priority. And that's patient safety. And so I wanted to talk a little bit about that here with Dr. Vidal because she also believes in this strongly. It's actually one of the main reasons that that we decided to have her join our team because it's really of kind of paramount importance to her. Correct?
Yes. Thank you, Dr. Earl, for the warm welcome. I mean, it's been an amazing week so far. I'm super happy. And thank you for everyone for the welcoming. And yes, 100%. One of the main reasons that I decided to join Pure Family was the safety, and because that's one of my priorities, and I take it very seriously.
Awesome. That's right. So you wanted to hit on a few points there because it's one thing to just kind of talk the talk and say, oh, X, Y, and Z clinic. Oh, yes, we're very safe. And you're like, well, how are you safe?
Yeah.
What have you done?
What are you doing?
Why are you different? Okay, so I do wanted to point out those kind of the very specific things that I think that we've implemented, we put into place that kind of shows that we're also not just talking the talk or we're walking the walk in terms of patient safety, which is our number one priority. Okay, and of course it starts with the surgeon. So myself and Dr. Vidal, and that means your education and that means your training, right? So we are both fully trained plastic surgeons. Not only that, we are both fully trained general surgeons as well, which means we have gone through years and years of education, training, examination, tests, and things like that. So I'll talk a little bit about myself, and I'll let Dr. Vidal talk a little bit about the course that she took to get here today. So for me, as many of you know, you've known me for a little while now. I went to Princeton for my undergrad, started, with education there. After that, medical school was at NYU in New York. And then I was actually here in Miami, so we have that in common. So I did my general surgery training here at University of Miami, Jackson Memorial Hospital. Did a full 5-year general surgery training. I also did 2 years of NIH trauma research during that time. And so I'm a full general surgeon and a board certified general surgeon as well. After that, then I went to Duke to do my plastic surgery training, which was a 3-year program. And so fully trained plastic surgeon, and then went on to do everything you need in terms of your board certification for that as well. So training and educating are some of the best programs here in the nation. I think it's really important. And it's not done so much nowadays, the fact that we had that full general surgery training, because that means we went through the whole gamut of general surgery, including trauma surgery, emergency surgery, and ICU care. A lot of time, a lot of nights spent in that ICU means that we know how to treat a patient, in terms of pretty much any sort of emergency that could potentially occur. But why don't you tell them a little bit about kind of your education, your training, and how you came here?
Yes, as some of you know, I'm born and raised in Puerto Rico, so I did my undergraduate studies at the University of Puerto Rico in biology, and then I went to Ponce School of Medicine, which is in the south of the island, an accredited medical school, and I did my medical school there. I take it, like Dr. Earl said, very seriously. So I studied a lot, top of my class, graduated, and was able to get into general surgery residency in Puerto Rico, which is very competitive in the island because at that time was the only general surgery program there. I did my full general surgery training, 5 years too. Graduated top of my class as well. Completed my general surgery boards.
Top of the class.
Board certified in general surgery. After that, I did a burn fellowship at Jacobi Medical Center, which is in New York, in the Bronx. So yes, a lot of ICU nights and sick patients.
So burn patients, some of the sickest patients there are, unfortunately, but and very, very difficult to manage as well. Correct. So a whole year of, I guess, long nights in the units. And stuff like
those patients tend to have a lot of fluid changes and obviously not as severe as the ones that we see post-operatively, but in the same line of fluid changes and things that if the patient gets a complication, I know how to manage well. And then I came here to Miami, to the University of Miami for my full plastic surgery fellowship, which is 3 years. And then I trained there, like the full spectrum of plastic surgery.
That's right. And then she's had like a mini fellowship with us here at Pure, which was the icing on the cake there. So, so yes, fully trained plastic surgeons. Okay, that's what you want to look for. I do think that's very, very important. It's like I said, like you wouldn't want me doing your father's cardiac bypass, right? So a surgeon's not a surgeon. So a plastic surgeon's a plastic surgeon. I don't really think that you should have like a dermatologist doing your plastic surgery or a gynecologist or something like that. I think you want to go to a fully trained and well-educated plastic surgeon for your plastic surgery procedures, and you don't want a plastic surgeon to do your heart surgery, right? That makes sense. So I think that's very, very important. We have that blue check mark there. Mm-hmm. All right. So the next step, of course, is surgical technique. Okay, surgical technique is very, very important. Especially when it comes to certain procedures that, if not done correctly, they could potentially be very dangerous. Of course, you can say that can apply to all procedures, but I think some of them more so than others, right? Mm-hmm. So, of course, the one that everyone talks about and it's the media and everything else is the BBL, right? So, I want to tell them some of the things that we do here and that we've learned also, here in the past few months here at Pure that we do differently to kind of maximize safety with the BBL procedure.
Yes, one of the things that when I was looking for jobs here in Miami, BBL is a very popular procedure. And when I trained at the University of Miami, I was trained to do it with ultrasound guided because it's very important to visualize where you're injecting the fat and make sure you're injecting it in a safe space, which is above the muscle, never below. And one of the things that I was double checking and making sure is whoever I joined had that same criteria and that same practice, and Dr. Earl does. And I was trained at the University of Miami, but I'm getting like he said, an extra fellowship and an extra training with his technique, and he's an amazing surgeon and extremely experienced with BBL. So I'm so glad to have that extra training with him.
That's right. No, I'm doing great. And so actually, probably one of the first surgeons in Florida to use the ultrasound is actually who Dr. Vidal trained with. And I was probably maybe like the second one to do that and to then to really start using it. So I started using the ultrasound in 2019, somewhere around September or so, and we've been using it ever since. Okay, and so that is a technique that we use, and that way that we're making sure where we're going or we're transferring fat along that danger zone, that we're doing it into that right space, which is between the muscle and the skin, okay, into that subcutaneous fatty space. That's where you want to be, and not into or deep to the muscle, because that's where those dangerous vessels could be. And so we got the ultrasound. The other thing that we use, of course, is the cell saver. So the cell saver is also very important. That allows us a little bit more flexibility in terms of the hemoglobins we accept. So our lowest hemoglobin is 11. If we didn't have that, it'd probably be 12. I think with the cell saver, we can have that a little bit more flexibility. Definitely not below 11 though, right?
Mm-hmm. Yes.
Yeah. Yeah, so we don't want to go below that. But yeah, tell them a little bit about the cell saver, how that is safer for them in terms of the recovery.
Yeah, when we're doing the liposuction, we suction the fat, but we also suction blood. We do use tumescent solution, which is mixed with a medication called epinephrine, which helps with vasoconstriction. So the vessels kind of shrink, so we don't get that much blood loss. But there is blood loss, and when we're doing liposuction around the trunk, you get an amount of blood in your lipoaspirator, which is the fluid and the fat that you take out. From that fluid, there is a combination of things like the fat and the fluid that we put in, and also the red blood cells, which are the carriers of the hemoglobin. So the cell saver helps filtrate that component. So we take the components that you don't need in your blood, like that fluid, the fat, and then we can inject the blood vessels or the hemoglobin back to your body.
That's right. So once we do the lipoaspirator, we let it sit. So I think I've asked this question before. Who knows what happens? Does the fluid go on top or the fat go on top? Are we getting any answers? Fat on top or fluid on top?
Fat's on top.
That's right. Fat's on top. Fat's less
And
dense
some
than
said
water.
fluid, so confused.
No, so the fat goes on top. The fat is actually less dense than water, so you allow that to sit for a while, and then so you got fat, and then below that you got bloody fluid. So that bloody fluid, then you can aspirate that out, and then you pass it through the cell saver. Cell saver separates the blood cells from everything else, and then those blood cells we give them back to you basically as an auto transfusion. Therefore, the overall blood loss for the case is less, okay? And so you lose less blood, you feel better in your recovery, you recover faster, you recover stronger, okay? So we use the cell saver pretty much for all our BBLs. It's actually not even like an option. If you're getting a BBL, you have the cell saver included in your packet, and also for your Lipo 360s, okay? So these are just some examples of the safe techniques that we use. Of course, there's many other techniques that we use. We can't go over all of them, otherwise we'd be here for 5 hours. But like for example, say the tummy tuck. We don't do aggressive lipo, especially in that central abdominal area with the tummy tuck, because we know, for examples, you always want to leave like a little layer, a small layer of fat underneath the skin after liposuction, because if not, you can increase the risk way high for lipo burns, which is not really a burn, but it's actually also, ischemia or lack of blood supply to the skin. So things of that nature. So many things that we do in terms of our surgical technique to try to minimize complications, okay? And the one thing, I didn't write it down here, but the one thing that we do have that, honestly, I don't know of any other place. Do you know of any other place in Florida that has cosmetic?
No.
I think, as far as I know, and don't quote me on this, but as far as I know, we are the only place that offers cosmetic, and we give it to all our patients, because even though we do all this to try to minimize your risk of complications, it is surgery, so complications can happen. The only way to have zero complications is to not do surgery, okay? And so when they do happen, you're covered by cosmetic, which will cover, to a certain amount, any sort of, bills and, financial, consequences of a potential complication if you end up in the ER or in the hospital or something like that. So that gives a lot of peace of mind for our patients, and honestly a lot of peace of mind for us as well. Because a lot of your regular insurances, if they find out that it was due to an elective cosmetic procedure, they won't cover you. Okay, so we have that here. So I think that's very important, that cosmetic short, because while it might not be in terms of safety, in terms of your livelihood, it's in terms of your financial safety.
Pocket safety.
And so we offer that for 100% of our patients. Okay. All right. So a lot of people ask, well, Dr. Vidal, so of course she's at Pure, and with that comes all our trained and educated staff. Okay, so yes, of course, you're using all our staff. So she's part of the team, part of the family. So our nurses, our nurse practitioner, our all our surgical assistants, which are excellent surgeons, and then of course our anesthesia providers, right? So we got the same group of people who have been vetted and who have gone through a lot of training and education, because we want only top-notch people working here at Pure. Okay, all right. This is one of the main things to really demonstrate that we're not just talking smack, so to speak, right? So tell a little bit about what this means, and the fact that we got this in an office-based surgery setting.
Yes, so to get this certification, you have to go through a lot of regulations and I forgot the word, visits, like they come,
Yeah.
they visit.
Surveys.
Surveys,
Yes.
yes, sorry. I'm like missing the word.
Yeah.
So to get this level, it's not everybody can. Like you can't just, I can go and just open a place on my own and just start doing surgery without this, right? And this is very important, and it's one of the, it measures safety in a written and standard level, not just because we said it.
That's right. So we are certified by JCO is the short term. It's the Joint Commission. Okay, the Joint Commission is pretty much the body that certifies the major hospital operating rooms. Okay, so there's certain levels of certification. Of course, the kind of entry level certifications is you got to be certified by the Florida Department of Health. So if the Florida Department of Health doesn't certify you, then you can't do surgery there. Okay, so I'm talking now office-based surgery setting, which is what Pure is. Then, of course, you can go a level above that. One of the most common ones there is called the Quad ASF. Okay, so it's like 4 A's SF. Okay, and that's a higher level certification there. And the highest, okay, level there is the Joint Commission. It's basically they're using the same kind of rules and regulations that they would expect of a tertiary care center, major hospital surgery center. And they're applying that to this office-based surgery setting, okay? And we've done this, we've passed this, we got our certificate. That means that they've gone through all our protocols, all our results, all our sterilization techniques, all our personnel, and they've all been vetted. We all passed the survey to get this JCO certification, okay? All right. Okay, and so after that, of course, this is extremely important, right? So, you know, there's always going to be some risk of infection with any procedure that you do. Unfortunately, we can never get that down to zero, okay? But we can try to, so we do take additional steps to, like, what would you just be, I don't know, what you call just normally required in order to do that, okay? So let's go over a couple of the extra steps that we take in terms of sterilization to try to minimize your infection rates here.
That's perfect timing because the next question was how do you prepare yourself daily before going into the operating room?
Okay,
So,
all right, why don't you take that one and then I'll jump into some of the sterilization steps we're doing.
Prepare daily. So, I mean, from the day before, you review your cases, you make sure that everything is set for the procedure the next morning. Come in the morning, we'll meet the patient, mark the patient, we discuss with them, like if you have any questions, anything that they want to go over. And then before we go into the OR, before you go in, everything is clean, all the instruments are sterilized, and everything is open in sterile field, which is called, which is like the table is completely clean, the instruments are sterile, and it's open with sterile gloves, and that's prepared in the room. And the UV light, it's put in the room for a period of 5 minutes, and that gives an extra protection for the sterilization technique. And then it's when we bring the patient in, and we start the anesthesia.
That's right. So that's excellent. So the UV light is one of the extra things that we do that I don't know of much of any other places that do that.
No,
so
I had read about it by the American Society of Plastic Surgeons, but I was impressed that Pure had that extra layer of protection.
Yeah, so we actually just jumped that up right on that. So it came out fairly recently, and the reason why people were wanting to do this and wanting to create one that's fairly easy to move around was actually came because of COVID, because UV light kills viruses in the air. Okay, so there's something floating around in the air. Of course, we can't see it, we don't know it's there, but UV light will kill it. And you don't need that much time. 5 minutes is enough to kill everything in the room, basically. Okay, so we have these UV lights. We use them at the beginning of the day, in between cases, and at the end of the day to basically continuously sterilize not only the room but actually the air that is in that room. Okay, all the air conditioning vents have HEPA filters as well. Okay, and so that gives another level there. we also, some of you may or may not know this, but in Florida, the water that comes out of the tap sometimes is not the best, okay? And sometimes can have certain bacteria in it, one of them being a tuberculosis, or well, a mycobacterium, not tuberculosis, a different type of mycobacterium, fortuitum is actually called. So we have a special hospital-grade filters over all the sinks, or in the sinks, all the water that's being used to clean the instruments, and that's not even that's even like a step before the actual sterilization. So of course you got to rinse out your instruments. So in order to rinse them out, you just use regular water, but we use a special filter that basically filters out 99.9% of all bacteria. Okay, and then once you've kind of done that, and then you actually put the instrument in the pouch and put it into the sterilizer after that. Okay. So another extra step that we do there in terms of our sterilization. And so with doing all this, we've been able to keep our infection rates much lower than the national average, especially for procedures where the infection rate's a little bit higher, such as the BBL. Now, is it going to be zero? Unfortunately, no. There is no way to have a 0% infection rate, okay? Can it be very, very low? Yes. So our, well, Dr. Vidal just started, but for me, for Pure, the infection rate for BBL has historically been about 3%. National, international average is closer to 10%. So it's less than half of that. And that was before we started the whole thing with the UV light and some of our protocols there. So this year is actually looking really, really good. As some of you know, I gave out all our numbers. We're completely open here. I tell you all about our infection rates and all that stuff at the end of the year. And so far, it's looking to be less than 3% so far. But I can't, we're only a little bit, halfway past. So I'm not gonna, harp on that just yet. But we'll see what it is. So far, it's looking really, really good. Okay. All right. And then this is unfortunate that we still have to talk about this. Yeah.
All right.
It's unfortunate we still have to talk about this. We thought by this point in time, we would have lifted a lot of our COVID protocols. And of course, you see, we're both here doing the video without masks, but we're both vaccinated, fully vaccinated. So the protocols are still in place. Okay. So yes, anyone coming in will have to wear masks. When our staff interact with patients, they'll have to wear masks. All our surgical patients still have to get their COVID tests within 72 hours of surgery. And of course, all the wiping and the alcohol and the hand washing and all that, of course, that's all in play as well. So we were one of the first to really determine or make clear our COVID protocols way back at the beginning of this whole pandemic. And we kept getting asked, when are you going to change them? And we said, well, we're not really sure what's happening. And unfortunately, we didn't really change them. And so they've been in place since then. And now with the whole Delta and all these infection rates going up, we're really, really glad we've kept all that. This includes, like I said, HEPA filters in our anesthesia machines as well, and all those extra steps that we've taken to minimize the risk of transmission of COVID.
So you currently do not know when we'll implement in-person consults again?
That's right. So we were hoping that we'd be able to do that, and unfortunately, with all this sudden rise in infections, really throughout the nation, but especially in Florida, we're kind of sticking to the virtual consults as our mainstay, and then there's going to be very, very rare exceptions, and if for whatever reason there is a rare exception, that patient needs to be tested before they come in.
Thank you. We have actually a lot of questions.
Yes.
Let's see. This one's multiple times, so I promise I would answer this. Do you suggest using Medi Honey post-op?
Yeah. What are your thoughts on Medi Honey?
Medi Honey, I use that a lot in burn patients. I think it's a good adjunct if you have an open wound. It is antibacterial, so it helps with the control of infections. I don't recommend it in the scar. I don't think it has any advantage with lightening or making it smaller or thinner. But yeah, if you develop an open wound, Medi Honey is a good alternative.
And what about steri strips for post?
Yes, we use steri strips. When after the surgery, we'll wake up with the steri strips in place, and they usually stay in place for like 7 to 10 days. And when you start showering, they start falling off.
Yeah, so they'll be there for about 7 to 10 days, sometimes longer. We don't want them to be in place for longer than 2 weeks. So if you do get to the 2-week mark and some of them have kind of stuck around, then you can go ahead and remove them in the shower at that point in time. It'll be easier to remove.
Question for Dr. Vidal.
Yeah.
What's the most important thing that you've learned from Dr. Earl so far, or something that's stuck with you?
Yes. I think is the relationship that he develops with the patients and the approachable that he is. I think that is something that not almost any surgeon does. Like taking the time for every week, doing these videos, teaching, getting involved with the community. So I think I learned that, and I want to implement that in my practice as well, because I think it's very important.
That's great. Thank you, and that's a great also segue, because and I was gonna leave it for an announcement at the end, but I think it's a great segue. So Dr. Vidal is going to be starting her own live as well. So it's going to be, I believe, on Tuesdays.
Tuesday.
Let's
That's right.
go!
All right, so now
Yes.
you're going to get the double the pure lives.
Yes.
And so Dr. Vidal will be doing the Tuesday one. And of course, she has a lot of topics that she want to discuss. Some of them which I don't really get into because, say for example, Labioplasty could be one. That's a procedure that she does, and I don't. So it's going to be great. It's going to be a great adjunct to all the educational stuff that we have out there for you.
Yes, we're going to start next Tuesday. We'll do one introductory one next Tuesday, just talking about a little bit about myself, my training, and answering questions. But please send via Instagram topics that you want me to add to the Tuesdays.
All right, another question for Dr. Vidal. Sorry, Dr. Earl, you're the star of the show. She's taking over.
Sounds good.
Yeah, step back. You seem to have good credentials. You're the top of your class. It seems like you had options. Why did you choose Pure, and why the vice versa? Did Pure, you guys? Why was this a good marriage?
Yes, I'll answer the first part of that question. For me, staying in Miami, in a place that was oriented on patient safety and good outcomes, was one of my priorities. Joining a well-trained surgeon that offered a variety of plastic surgery procedures, and this is one procedure, and the combination of his experience with me coming and implementing some new stuff, but also learning from him. So I think for me, it's an amazing opportunity and super great.
Yes, definitely. And then from our point of view, we interviewed quite a few people. I think Dr. Vidal had a lot of things that we really felt that she would just be kind of easily become part of the Pure family here, which is really, really important to us. So yes, of course, her tremendous education, tremendous training. We know she's going to be very, very skilled. Easily learn all our protocols and techniques and things like that. But the way that she cares about the patient's safety and the patient in general, and then also the fact that she's bilingual, I think that's also incredibly important, and that when she came and started talking to us and started talking to the staff, it kind of felt like I believe she felt like she was at home, and we kind of had that reciprocal feeling where she felt like it just felt like she belonged here. And then, sometimes it's hard to describe, but it's kind of the feeling you get after you talk to someone a few times. So I think she's a great adjunct to Pure, and we look forward to having her here.
Thank you so much.
Another one for Dr. Vidal. We know that you're going to embody the whole Pure image and everything about safety. What are you going to bring different to Pure Plastic Surgery, as in any cases you're going to do different that Dr. Earl doesn't, or anything else?
Yes, I mean, as Dr. Earl mentioned, I'm going to be performing labioplasties here. This is one of the things that I do. Also, I like to do facial aesthetics. So blepharoplasty, which is eyelid surgery, facelifts, neck surgery, injectables also. So a few things that also I can bring to the practice. And
Yeah, definitely. And that last one is a good one too. So we haven't been doing a lot of injectables, a lot of it because of COVID as well. But also, it's not kind of something that I'm particularly interested in, but Dr. Vidal that certainly is, and she's had a lot of experience with, the Botox and the fillers and things like that. So that's a whole area of Pure that we really, want to expand. And now with Dr. Vidal here, we can do so.
Okay. Next question, just a general question: is the fat removal cap 1 liter for mini tummy tuck, as well as regular tummy tuck?
That's right. So the rules set forth by the Florida Department of Health are as follows. So if you're doing a strictly liposuction procedure, plus minus fat transfer, and also if you're doing something like body tight or J-plasma, that's okay too, then the amount of fat that you can remove is 4 liters. And we're talking about the supernatant fat. So once you remove all the fluid and everything else, the pure fat that's left behind, you can do up to 4 liters, okay? Now, as soon as you make a significant incision, like you're adding another procedure, whether it's a breast augmentation, a mini tummy tuck, breast lift, etc., arm lift, or anything else, then that limit drops to 1 liter, okay, of supernatant fat removal in that one setting.
Can we schedule the special prices with Dr. Vidal, but schedule them up to a year out or further?
So the specials are for surgeries that are done this year, okay? So the specials are for people that are booking for 2021.
Thank you very much. We're already at 32 minutes. I know.
32 already?
Yeah, no, it goes quick. It goes very quick. So
Awesome.
many.
Is
So
there
many
one
questions.
more there for Dr. Vidal? Should take it home.
Will you and Dr. Vidal use the same anesthesiologist?
Yes.
So we're gonna use the same team, yeah. You guys, a lot of you know Raquel, and then we have the same team for anesthesia, our CRNA team, and yes, and they're gonna be basically involved with all of our patients. It's not like I have like one person, she has one person. No, it's the same CRNA team headed by Raquel.
All right, I think we got time for a few more questions. 2 more?
2 more. All right, let's
2
do
more.
it. All right, let's do it.
Will you guys be introducing injectables?
Yes, definitely. Yeah, that's one of my areas
All
of
right.
interest. So yes, Botox or neuromodulators and injectables. Yes, fillers.
Do you take patients with sickle cell trait?
Yes. So sickle cell trait is okay. Sickle cell anemia, unfortunately, is not. Okay, the risk there is too high in terms of having an issue with the surgery or a potential crisis. So if you have sickle cell anemia, unfortunately, you don't qualify. But if it's sickle cell trait, then that's okay.
All right, you guys, one more question? We good? One more?
Yeah.
I keep just one more. Last. This is an interesting comment. Dr. Vidal is going to be the queen of BBL. Mark my words. I don't know where she's getting this info from, but all right. I guess. When is it safe to wax the tummy tuck incision since the pubic hair goes all the way up there?
Okay.
To wax it?
To wax
Okay.
wax pubic hair that is close to the incision.
I would say that after at least 4 weeks, so everything is well healed. You don't want to be waxing and putting pressure on an incision that is fresh that it can open up.
That's right. So yeah, I think so. So you want to make sure that's fully sealed before doing the waxing for the hair.
All right, that is sorry we couldn't get to all the questions,
Okay.
but yes, I know you gotta
Okay.
get out of
Next
here.
week, bring questions next week.
That's right. So next week you're gonna get double the live. So much more questions are gonna be answered. So we're really excited about that. We also got some exciting things coming along. We'll get you more details, but I'm sure you guys, some of you still remember that I talked about Quo not too long ago. So stay tuned for that because very, very soon we're going to get some exciting news regarding that front. Okay? All right, everybody. Well, I hope you enjoyed this. And like I said, tune in next Tuesday. We'll be sending you the times as the date comes closer for the live with Dr. Vidal. And of course, we'll always be here for a hump day with Dr. Alex Earl. Ciao.